I started going to Susan's Legacy in January of 2018, and I was referred through a social worker for the DA's office. And so what I first did was I met with the original social worker, or the original case manager there. So she actually came to my home, and we went over all my goals and what I wanted to do. So they have a checklist, and you go through 10 different things that are important to you, and they include health and counseling and all kinds of other things that are important to you. And at that time, my main goals were family reconciliation. And so she helped me get back in contact with my children, and she would even set up supervised visits with my girls through my ex-husband. So we used that part of the service, so family reconciliation. And then she helped me get services through Sage Neuroscience for some mental health issues that I was having. So we did that. So those was one of the services offered through case management. And then I started meeting with the therapist. And so he would meet with me once a week, and we would go through all kinds of mental health goals that I had at that time. And so a lot of it was like reintroduction to society, and then just coming back with things I needed to just go from not being around other people to back into being around people. So he and I worked through weekly and monthly goals. And so I would meet with him. And then I also used the integrity program with the group. So I would have group therapy for an hour and a half every other week. So I went through the whole integrity program with Susan's Legacy. And so I used we used meditation, and then we had goal setting systems through that. And we were able to discuss all the different things that were going on in our lives and how we could be better adjusted. And a lot of the girls were there for addiction, but I was there for mental health. But they were really good to learn from, because it was a whole demographic of women that I probably wouldn't in my normal life have had contact with. And so they were homeless, and they had drug issues, and a lot of them didn't even have a place to stay the night before. And so just hearing all their struggles and what they were going through, and then what I was going through, it was really nice to have an overall base of people to talk to. So I was in the group program for over a year, and then that therapist passed away and from cancer. And so I know they're regrouping on what they're going to do with therapy. And I've never really done outings with Susan's Legacy, but I know they do them. And that's something that they've worked on through the program. I have been part of where you submit to drug testing so that they can make sure that you're staying clean. And that's not an issue I have, but it is something I've participated in. So overall, I enjoyed that. The case managers keep track of your goals, and then the therapists also keep track of your goals. And so I have a current therapy I do every 2 weeks through Susan's Legacy, and we've worked on education goals, we've worked on job goals, we've worked on just regular mental health goals. So there's a variety of services offered. And one of the best things about Susan's Legacy is that it's nonprofit. So you don't have to worry about copays or any of that kind of thing. So that's been really a big help to me, because I didn't have to put my therapy or what I was learning up against my finances. I was able to just benefit from the overall service, and it's easily accessible, and they always are willing to call if I need anything or meet with me or anything that needs done. So I'm very thankful for the program, and I'm glad I still get to participate to this day. When I first started with Susan's Legacy, I was really struggling, and I've had this a few times with anxiety really bad. And so they were able to walk me through different strategies that I could use to help control my anxiety and other behavioral health issues, depression. One of the things that I've done is using where I record things, or journaling to help me better process my emotions and that kind of stuff. So, and then all like the counting methods and the things that are centering or just finding your hands, all those things to help you with anxiety. Also through depression, when I was working with Dennis, I did a lot of poetry writing and a lot of stuff with just even fiction writing to work through emotions, just through imagination and that kind of stuff. So those also helped. So from the time I've started until now, it's like I've cycled through several different mental health issues, but I've been helped in different ways by the different providers through the program.